Knee replacement or knee arthroplasty is a surgical procedure to replace the weight-bearing surfaces of knee joint to relieve the pain and disability. During the surgery, damaged bone and cartilage are replaced with parts made up of metal and plastics. Knee replacement surgery usually takes 1 to 2 hours. To perform the procedure, the surgeon make an incision over the knee, remove the damaged bone and cartilage, and implants the replacement parts. There are mainly two types of knee replacement. Number 1, total knee replacement, and number 2, partial knee replacement. In total knee replacement, the entire joint is replaced with artificial surfaces, while in partial knee replacement, the damaged compartment of knee is replaced. The partial knee replacement is also known as unicompartmental knee replacement. The most common reason for knee replacement surgery is to ease pain that is caused by the severe osteoarthritis, like grade 3 plus or 4. The other reasons for getting TKR is: number 1, patient is having very much difficulty in walking, stair climbing, or even in ADL. Number 2, rheumatoid arthritis. Number 3, knee injury. Number 4, knee deformity and gout. Number 5, hemophilia. And number 6, pain and loss of cartilage. Before surgery, start physiotherapy for strengthening muscles. So in post-operative phase, you will have less difficulty in rehabilitation. After surgery, there may be chances of the clot formation through your calf muscles to the circulations. So, your doctor provides some blood thinner medicine to prevent the chances of deep vein thrombosis. For pain, the pain relievers are given. A physical therapist may visit you in the hospital on the first day after your surgery. This person is called an acute care physical therapist. In that visit, your acute care PT may help you to sit up in the bed, get out of bed, and start to walk with the support of walker. Firstly, the wheel walker is often used after surgery. This walker will give you extra support while walking. Your acute care physical therapist will also have you do knee exercise while you are in the hospital bed, like ankle pumping exercise or static quadriceps exercise. Patient improves functional mobility after 2 to 3 days in the hospital. At this point, patient is discharged to the home. After discharge from the hospital, the patient should have to follow 5 to 6 weeks of exercise program at home. The physiotherapist will visit patient at home and make him do the exercise. Exercise program for the first week. Number 1, ankle pumping exercise. This exercise is taught to patient for prevention of deep vein thrombosis. To perform this exercise, patient should have to move his ankle up and down continuously for 10 to 15 times and do this exercise set every 2 to 3 hours. Number 2, static quadriceps exercise. To perform this exercise, lie on your back with your legs straight. Put a rolled towel below the knee and push it. Hold it for 5 seconds and release. Repeat this exercise 10 times. Do 2 sets a day. Number 3. Gluteal sets. Lie on your back with legs straight. Squeeze the buttocks together and tighten the buttocks muscle. Do not hold the breath. Repeat this exercise 10 times and do 2 sets a day. Number 4. Heel slide exercise. To perform heel slide exercise, lie on your back, bend your surgical knee by sliding your heel towards your buttocks. Repeat 10 times and do 2 sets a day. Number 5. Short arc quads. Lie on your back with a towel rolled under your knee. Slowly straighten your surgical knee by lifting your foot up while keeping your thigh on the rolled towel. Repeat 10 times and do 2 sets a day. Number 6. SLR. Lie on your back with your non-surgical leg bent. Tighten your knee on surgical leg and slowly lift your leg to the level of the bent knee. Keep your back flat on the surface. Repeat 10 times. Do 2 sets a day. Number 7. Hip abduction and adduction. Lie on your back. Keep your knee straight and toes pointing towards the ceiling. Side your surgical leg out to the side and back to the center. Repeat 10 times. Do 2 sets a day. Exercise program for week 2. Continue all the exercise of week 1 and add on the following exercise. Number 1. Your physiotherapist will teach you the proper way of walking by support of walker. Start walking with the walker as directed by your physiotherapist. Number 2. Isometric adductor exercise. Bend your both the knee and put a squeeze ball between them. Now squeeze the ball and hold for the 5 seconds. Repeat it 10 times. Do it twice a day. While doing heel slide exercise in this phase, apply some oscillatory force at the end of the movement. Exercise program for week 3. At the third week, the stitches will be removed, so daily apply oil massage at the knee. Continue all the previous exercise and add on the following exercise. Number 1. Bridging. Bend both the knee and lift your back upward. Hold it for 5 seconds and release. Repeat 10 times and do 2 times a day. Number 2. Sitting knee extension. Sit on the chair with back support. Now try to extend the surgical knee and if possible, push the surgical knee by non-surgical leg. Repeat for 10 times and do 2 times a day. Number 3. Sitting marching exercise. To perform this exercise, sit on the chair with back support. Now march the affected knee as shown in the picture. Repeat this exercise 10 times and do 2 times a day. Now start walking with the help of stick or tripod. Your physiotherapist will teach you the proper way of walking by help of stick. Walk 2 to 3 rounds at the end of every session. And always remember, apply ice after exercise session. Patellar mobilization. Move the patella in upward and downward direction and then lateral medial direction. Sit to stand exercise. Stand up by slightly leaning forward and sit the same way. Take support if you need. Do this exercise 10 times and repeat twice a day. Exercise program for week 4 to 6. Continue all the previous phases exercise and add on the following exercise. Number 1, standing up and marching exercise. Number 2, heel raise exercise. Now, in this stage, stair climbing exercise should be start as directed by the physiotherapist. During climbing up, put your non-surgical leg first and then affected leg. While coming down, put your affected leg first and then non-affected leg. Practice this exercise 10 times and twice a day. Now, patient should start walking regularly with the help of stick and do all the exercise until feel confident. Do every exercise prescribed by your physiotherapist. Do take rehabilitation seriously. Don't put unnecessary stress on the knee. Don't schedule other surgical procedure while you are recovering. Avoid prolonged standing. Avoid climbing with affected leg first and do climb one stair at a time. Avoid unsupport climbing. Avoid cross leg sitting. Avoid long immobile sitting. Do sit on the chair which have arm support. And don't give up. After complete recovery, patient can engage in various low impact activities such as walking, swimming or biking, but should avoid higher impact activities such as jogging or jumping. Patient should have to stay in contact with physiotherapist and talk about ways to stay more active after TKR. For most of the people, knee replacement surgery provide pain relief, improve mobility and better quality of life. Most knee replacement can be expected to last at least 15 to 20 years.